Your brain doesn't fail without warning. It whispers first, then resets, daring you to ignore the danger it just revealed. When weakness, blurred vision, or confusion vanishes in minutes, it's not recovery. It's a countdown to something far worse. Welcome to Wellness Unfolds, where we explore the deepest secrets of the human body to help you live a longer life. Time is the most valuable currency we possess, yet we often ignore the subtle whispers our body uses to warn us. We often believe that life-changing medical events happen instantly, striking without warning like a bolt of lightning from a clear sky. However, the truth is that our brain is a complex machine that often signals distress long before a total shutdown occurs. Today, we will uncover the silent signals of a stroke, specifically focusing on the transient signs that are easy to miss. These fleeting symptoms are known as transient ischemic attacks, or TIAs, and they are the biggest red flags you can get. To understand these signs, we must first look at the river of life flowing through your veins and into your brain. Just like a busy city needs clear roads, your brain requires a constant, uninterrupted supply of oxygen-rich blood to function correctly. But sometimes, a storm gathers silently inside these vessels, creating a blockage that temporarily cuts off the vital fuel supply. This is the mechanism of a TIA, a temporary blockage that mimics a full stroke but resolves itself before permanent damage. The first major warning sign is sudden weakness or numbness, specifically affecting only one side of the body or the face. You might feel a strange heaviness in your face, as if gravity is pulling harder on one side than the other. This happens because the brain controls the body cross-laterally. A blockage on the left side affects the right side of the body. The arm may feel like dead weight, refusing to obey your commands, or you might experience a sudden loss of sensation. Simple tasks like holding a pen or gripping a steering wheel become impossible in a split second due to this weakness. It can also affect the leg, making it feel as though your foot is stuck to the floor or completely asleep. This is a direct result of neurons in the motor cortex being starved of oxygen, failing to send signals to muscles. Numbness is often described as a pins and needles sensation, but much more intense and covering a larger area of skin. In a TIA, this feeling might last only a few minutes, leading many people to dismiss it as just a tired muscle. Ignoring this sign is dangerous because it indicates that a major vessel in your brain is struggling to maintain blood flow. The second critical sign involves communication, specifically difficulty speaking or sudden trouble understanding what others are saying to you. You might know exactly what you want to say, but the words come out slurred, garbled, or completely different from your thoughts. This condition, known as aphasia, occurs when the language centers of the brain are deprived of oxygen for a short time. It is not just about speaking. You might suddenly find that the words of others sound like a foreign, alien language. The frustration is immense because your mind is clear, but the bridge between your thoughts and your voice has collapsed. Family members often mistake this for fatigue or confusion, not realizing a neurological event is unfolding right in front of them. Even if speech returns to normal within minutes, the underlying cause remains a ticking time bomb that needs immediate medical attention. Sometimes, the difficulty isn't in speaking, but in reading or writing, as the brain loses its ability to process symbols. Sudden inability to use a phone or write a note is a subtle but powerful indicator of language processing failure. The third sign is a sudden change in vision, which can be terrifying and is often described as a curtain falling. You might experience double vision, blurriness, or complete loss of sight in one eye, appearing out of nowhere without pain. This specific symptom, often called amaurosis fugax, feels like a shade is being pulled down over one of your eyes. This occurs when a small clot temporarily blocks the retinal artery, cutting off the blood flow to the eye's sensitive tissues. Many people mistake this for an eye problem, scheduling an optometrist appointment instead of rushing to the emergency room immediately. Double vision is another variation, where your eyes fail to coordinate, signaling a problem in the brainstem or cerebellum. Vision is crucial for balance, so visual disturbances often lead to stumbling, making the situation even more dangerous for the individual. Just like the other symptoms, vision may return quickly, leading to a false sense of security that everything is fine. However, temporary blindness in one eye is one of the strongest predictors of a major stroke occurring in the near future. The fourth sign is sudden dizziness or a loss of balance, which is particularly dangerous when combined with other symptoms. This isn't just feeling lightheaded. It is vertigo, a sensation that the world is spinning around you while you stand still. Unlike normal dizziness from standing up too fast, this sensation strikes without a clear cause and can be completely debilitating. The cerebellum controls coordination and balance. When its blood supply is interrupted, you lose the ability to orient yourself in space. You might feel like you are being pulled to the ground by a magnet, unable to walk in a straight line. Observers often mistake this for intoxication, which can delay calling for help, wasting precious minutes that could save brain cells. If this dizziness is accompanied by double vision or slurred speech, it is almost certainly a sign of a brain issue. Sudden loss of coordination is a medical emergency, not a moment to sit down and wait for it to pass. The fifth sign is a sudden, severe headache, often described by survivors as the worst headache of their entire life. Medical professionals call this a thunderclap headache because it peaks in intensity within seconds, striking like a physical blow. Unlike a migraine that builds up slowly, this pain is instant and overwhelming, often signaling bleeding in or around the brain. This symptom is more common in hemorrhagic strokes, where a vessel bursts, creating pressure inside the skull that causes pain. It may be accompanied by a stiff neck, facial pain, or vomiting, distinguishing it from a typical tension headache or migraine. If you experience a headache that feels different from any you have had before, do not take a painkiller and sleep. This is a critical alert that requires a CT scan immediately to rule out a brain bleed or a ruptured aneurysm. The sixth sign is losing a part of your visual world, a phenomenon known as visual neglect or visual field loss. You might not realize you are missing half the world. You simply eat what you see and ignore what you don't. This often results in bumping into door frames, furniture, or people on your affected side because your brain ignores their existence. This is not an eye problem, but a processing error in the brain, specifically in the parietal lobe, which maps space. When someone points out what you missed, you are surprised, as if the object magically appeared out of thin air. Imagine the danger of this symptom while driving. Missing a car or pedestrian on your blind side could be fatal. The seventh sign is sudden confusion or difficulty performing familiar tasks that you have done thousands of times before without thinking. This is called apraxia, where the brain forgets the sequence of movements needed to complete a simple routine action. It is not memory loss like dementia. It is a sudden disconnection between the idea of the action and the execution. You might find yourself trying to use a tool incorrectly or forgetting the steps to make a cup of coffee. This sudden onset of confusion is a hallmark of a stroke affecting the parts of the brain that plan movements. The eighth sign involves a sudden change in gait or how you walk, which can happen even without dizziness. You might start dragging one foot, or your walk becomes wide-based and unsteady, as if you are on a boat. This ataxia is a sign that the brain is struggling to coordinate the complex muscle movements required for smooth walking. It is not just clumsiness, it is a neurological failure that can lead to falls and serious injuries if ignored. The ninth sign is a sensation of being tilted or falling, even when you are sitting perfectly still and safe. This sensation often comes from the brainstem, which houses the vestibular nuclei responsible for your sense of verticality. Because this feeling causes nausea, it is frequently misdiagnosed as a stomach virus or food poisoning, delaying critical stroke treatment. However, if the nausea is sudden and comes with balance issues, it is a brain problem, not a stomach problem. These symptoms are diverse, but they all share one common trait. They appear suddenly and disrupt normal function immediately. But here is the most dangerous trap. In a TIA, these symptoms might disappear completely in just a few minutes. The body's natural defense system dissolves the clot, restoring blood flow and making you feel normal again very quickly. You might think, that was strange, but I am fine now, and decide to go back to your daily routine. This is a fatal mistake. A TIA is a warning shot, a clear signal that a massive stroke is imminent. Statistics show that a significant number of people who have a TIA will suffer a major stroke within 48 hours. You must treat a TIA exactly the same as a full-blown stroke. Call emergency services immediately and get to a hospital. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call emergency services without delay. Check their face for unevenness. Ask them to raise both arms to see if one drifts downward involuntarily. Ask them to repeat a simple sentence to check for slurring. And if any sign is present, call for help. Beyond the emergency, understanding these signs gives you the power to make lifestyle changes that can prevent future attacks. Controlling blood pressure, managing diabetes, and staying active are your best defenses against the formation of these dangerous clots. Recognizing a TIA saved this grandfather's life, allowing him to enjoy many more years with his loving family. Your brain is the command center of your existence. Protect it by listening to the subtle warnings it sends you. Please do not keep this information to yourself. Share it with your friends and family because it could save a life. Stroke does not discriminate by age or gender, so everyone needs to be armed with this critical knowledge. Thank you for watching Wellness Unfolds. Please share this vital information to save a life and subscribe for more health insights.